Hi, everybody. Welcome back. Last month on Twin Cities Live, we met our newest health expert here on Twin Cities Live, Dr. Annalisa Skor-Swigert, practices at Southdale OBGYN, and today she's answering your questions.
We asked what you want to know about women's health, and we're happy to welcome Dr. Swigert this time into the studio. Nice
Welcome to the fake living room.
It's so great to be here.
A fake living room,
so fun.
But a very real conversation. This is wonderful. I think a lot of people at home are happy that other folks submitted questions, and they will be listening with an attentive ear. Let's start with Melinda. Now, I'm just going to warn you, Melinda's got some loaded questions here, okay? So
I'm
buckle
ready,
up.
I'm ready.
I'm going to ask all of them, and then you answer as best
Okay.
you can. Melinda asks, what are the symptoms for ovarian cancer? Who is high risk? Is there anything that I can do to decrease my risk? Does a pap smear test for ovarian cancer? If not, are there any tests that I can take if I am symptomatic? That's a lot.
Yeah.
What do you say? How do you break that all down?
Lot of questions there. I think I'll start with just educating everybody that a pap smear only screens for cervical cancer. I think a lot of women believe that when they have a pelvic exam, they're always getting a pap smear, or when they get a pap smear, it's going to also check for ovarian and uterine cancer, but it only checks for cervical cancer.
Okay.
Unfortunately, we don't have a routine screening test for ovarian cancer like we do for cervical cancer or the mammogram that we have for breast cancer. And unfortunately, the symptoms of ovarian cancer can often be fairly vague. Pelvic pain, bloating, changes in appetite, fatigue, things that you might experience all the time anyway. So truly the most important thing in terms of decreasing risk, always make sure to see your provider every year for preventative care. See a women's health care provider who can talk to you about any symptoms that you're having, who can do a full pelvic exam. And then if you have new symptoms or experiencing something that's uncomfortable or painful, make sure to contact your doctor so they can further evaluate those symptoms.
So don't wait. Call and get an appointment. Yeah.
Right. If you're having new symptoms, don't wait until your next preventative visit.
Right.
Call, get an extra visit.
Okay, so Melinda has another question too about something I think a lot of women struggle with, and even understanding what it is. Melinda asked, what are the symptoms for endometriosis? Is it treatable? Can it cause endometrial cancer? And can you get endometrial cancer if you've had a hysterectomy? Melinda, you got to go see Dr. Swigert.
I know,
got so many
right?
questions here. She's getting some
Solid
free
hour
advice
for
right
her.
now.
No kidding.
I think I'll start with endometriosis. I get a lot of questions about that, especially from younger women. The symptoms of endometriosis, the primary symptom is very painful periods. Often women have pain during sex or pain in between their periods, pain that's not relieved with Advil, pain that keeps you home from school or keeps you from going to work.
Okay, that's a difference
And
there.
exactly. Endometriosis can sometimes be difficult to diagnose because it's not seen on ultrasound or on a CT scan, so we often will presumptively treat the symptoms with different medications before moving towards surgery. But the symptoms of endometriosis are definitely treatable with medication and also with surgery.
Okay.
Let me hone in on the next part of her question, because if it's, a bother or painful, that's one thing. She also asks if that endometriosis could cause endometrial cancer, and obviously the C word starts to scare everybody.
Correct.
If you have endometriosis, do you then become nervous that this could become something much more serious?
No, endometriosis is primarily a disease of premenopausal women, so women from the age of the onset of the period until they stop having periods. Endometrial cancer tends to be more common in the late 40s and after menopause, and endometriosis does not significantly increase your risk for endometrial cancer.
Okay, that's good to know. Let's move on to Patricia's question. She asked, how about thyroid? Should it be checked out other than a simple blood test at the regular clinic?
We get a lot of questions about thyroid function. I think women know that an underactive thyroid often can cause weight gain or fatigue, again, symptoms that many of us experience at different times in our life. And just to clarify, the thyroid is the gland here in the neck. So it's not in this part of the body, which I'm usually taking care of.
So I was going to ask that question. I would never think if I was a woman, I wouldn't be thinking, I got to ask my OBGYN about my thyroid.
But that's probably the doctor that most of us see most regularly.
That is correct. I mean, we provide the full scope of women's health care.
Right.
And we do an exam feeling the thyroid, but in fact, the thyroid is best evaluated by a simple blood test that can be done at your doctor's office.
Okay, so when you have a relationship with your doctor, you're talking through all these things. What I like too is when you're saying, okay, if you have these symptoms or if it's something painful, it's so hard for people to know, like on the spectrum, what's something to worry about and what isn't.
Exactly.
And if you have a provider that you trust, that knows your history, that knows like what things have been like in the past, I feel like you're more likely to get better care. Do you think so?
That's correct, because you know if there's been a change in her health.
Yeah.
You know her family history, which contribute to all of this. Very important.
Yeah, that's good.
All right,
One more.
Leslie gets the final question
Final
today.
one.
And here's what Leslie asked. This is rather topical. Can I get a COVID vaccine during pregnancy. What say you?
Well, I have something very important to say in that we strongly recommend the COVID vaccine during pregnancy. In fact, today the CDC announced that there is new data supporting the safety of the vaccine in pregnancy. We know that getting the vaccine while you're pregnant protects not only mom, but protects baby as well. You can also get the vaccine if you are breastfeeding. And when you're breastfeeding and when you're pregnant, the mom's body makes natural antibody that naturally will protect the newborn baby.
This is good stuff. Dr.
Yeah.
Swigert, you're so helpful.
Wonderful
you have
to
such
have you
good
here.
Information. Southdale OBGYN.
This was my first visit here, by the way, with an OBGYN.
Well, I'll be back.
Officially.
I'll be back, yeah.
Very exciting.
So Southdale OBGYN has 2 locations. They're in Edina and Burnsville. And again, they want all women to have that strong and trusting relationship with their healthcare providers. And we have a link to book an appointment on TwinCitiesLive.com.